Today we're interviewing Dr. Carlos Cuevas. Dr. Cuevas is an assistant professor in the School of Criminology and Criminal Justice at Northeastern University. Dr. Cuevas, could you tell us, please, how referrals come to you for psychosexual evaluations?
Sure. Typically, referrals for psychosexual evaluations are done at our agency at New Directions Assessment and Counseling Services. Most of the time, those are referred by probation or parole officers who have individuals they're supervising who have been convicted of some sort of a sexual offense and are in need of an evaluation and potentially also treatment. Occasionally, we'll also get referrals from attorneys who are looking to have a client evaluated either pre-adjudication or pre-sentencing. But the majority of the cases will typically be referred through either usually probation or sometimes parole as well.
What does the evaluation consist of?
The evaluation that we do tends to be pretty thorough. It includes initially a clinical interview, and then we use a number of psychological tests to evaluate the individual's mental health needs, personality characteristics, sexual interest, and sort of any other relevant criminological or mental health factors that may be associated with their risk for reoffending and their treatment needs if they need it. We also use some of the empirically validated instruments that help us estimate recidivism risk to help with issues around managing risk factors and supervision.
I'm assuming that all of these tests are in Spanish.
For the Spanish-speaking clients that I usually see, all the instrumentation and the interview as well is all done in Spanish. So all the testing materials are in Spanish, the interview is done in Spanish, and typically what we know from the research is that for both evaluation purposes and treatment purposes, you're going to tend to have better, more reliable data with an individual if it's done in their preferred language or their language of origin.
Once an individual gets referred, how long does it take to actually complete the evaluation?
The evaluation in total usually runs anywhere in the range from about 7 to 10 hours. That tends to include also not only the time during the interview and testing, but report writing time. Now, how quickly it can be turned around in part depends on issues around scheduling and such, but typically you're looking at about 3 or 4 sessions with the client, so the turnaround time in part depends on how quickly they can be scheduled. Typically, on average, I would say you're looking at probably in the range of from the time of the first interview to having the report done, I would say maybe around a 3-week period or so.
Can you give us an example of what some of the recommendations are that you might make?
Sure. Recommendations, and primarily what we evaluate, surround first any sort of mental health or psychological factors that merit attention or treatment for the individual, as well as whether these are factors that might be associated with sexual recidivism or reoffending of any kind. We also make recommendations around what type of treatment may be beneficial for them, not only in terms of mental health variables, but in terms of specialized sex offender treatment, if that is something that is appropriate. We also can make recommendations around what might be particularly important risk factors that need to be paid attention to. So, for example, substance abuse is a very strong risk factor for reoffending. And if we have evidence that there's concerns around substance use and that that's a particularly crucial issue for the individual, we'll make recommendations about potentially additional treatment and certainly talk to the probation officer about what might be some supervision interventions that might be helpful to help manage that individual.
Once the report is completed, who does it go to?
Typically, the report gets sent back to the probation officer. If they're the referral source, they will be the first and primary recipient. The individual themselves can also make a request for it, but usually we encourage them to obtain a copy from their probation officer. In cases where clients may have been referred through their attorney, then the report, if the attorney requests one, would be sent to the attorney.
Well, great. That gives us an overview of what an evaluation consists of, and thanks.
Happy to talk to you.
Okay, same here. Bye-bye.